Welcome to this educational video on the Mental Health Act 1983. This is aimed at registered nurses who need to know the correct way to complete section paperwork. Objectives. What is the Mental Health Act? How we use it in a general hospital, completing paperwork correctly, and some frequently asked questions about section patients that people often ask me. So what is the Mental Health Act? As you can see, it is a legal framework that provides the authority to treat those suffering with a mental illness against their will for the protection of their safety or the safety of others. It also covers matters in relation to care and the treatment of such patients. There are 149 sections of the Mental Health Act, but don't worry, we're not going to talk about all of them. Commonly, this is referred to as being sectioned. Although this term can be misused, it's important to remember that not all people who have a mental illness are sectioned. There is stigma and stereotyping surrounding this matter. Many people voluntarily go into hospital, but the Mental Health Act does ensure that when somebody is felt to be a high risk of harm to themselves or others and does not agree to hospital treatment, there are means of treating somebody against their will. So there are legal documents and legal paperwork that you must be aware of, and you need to be aware of how to complete them correctly. These are the forms that we're going to go through in detail. The Form H1 relating to a Section 5.2, a Form H3 and a Form H4. We will also then look at some individual sections including a Section 2, Section 3, a Section 5.2, a Section 136 and a Section 17. I know it sounds a lot, and I'm going to try and break it down as much as I can. Here is some background information that you may or may not find interesting. The Mental Health Act originates from what was known as the Madhouses Act 1774. This was created to give rights of access to what were then known as madhouses, where people who were deemed to be insane or suffering from lunacy were kept in a confined space. Sometimes you could be held in these places even if you weren't suffering from lunacy, but somebody else deemed that you were. The Act outlined regulations due to their misuse, and penalties were set for overcrowding, and they were subject to regular inspections. Over time and various reformations of the Act, we now know it to be called the Mental Health Act, thankfully. So people often ask me, is this the same as the Mental Capacity Act? It's different to the Mental Capacity Act. They are very different acts. The Mental Health Act provides guidance on dealing with a mental disorder. It does not cover aspects relating to physical health care. The Mental Capacity Act provides guidance on dealing with persons lacking capacity. Many patients can have capacity and still be detained under the Mental Health Act. This can be really confusing for healthcare professionals because the acts do cross paths and may apply to the same patient in some cases, but generally where a person is suffering from a mental illness that they require treatment for, the Mental Health Act is preferable. Throughout this teaching session, I will make reference to something called Section 132 of the Act, which outlines that all patients have a right to appeal their section, as patients have human rights. We have a legal duty as registered nurses to inform patients of this. There are leaflets available in the Mental Health Act folder on MAU, and you must complete the relevant boxes on the forms, which is usually the patient's name and the date that their section ends. This will become more clear as we go on. You should also document that you have informed a patient of their rights. Many patients that I do see here on MAU sometimes don't even know that they've been sectioned on a 5.2, for example. So we really need to be explaining this to patients. If you were unable to explain this to them because maybe they were refusing to talk to you, or they were too distressed, or they were too unable to comprehend the information, you must at least document your attempt in their notes and retry later. If you do have a patient that wishes to appeal their section, currently the UHDB process for this is still under development. But you can explain to the patient that the process is in development, but in any case, when they get transferred to their mental health inpatient unit, they will be able to formally appeal their section. If you have any questions about this, then just speak to me. To make things a little easier, we're going to follow a case example of a patient who, for this purpose, is called Janet. Janet has been admitted to MAU for treatment. She's 27 years old. She's trying to take her life by taking an overdose of 80 paracetamol. She has a history of depression and anxiety. She is desperate to leave hospital. She has already tried to abscond from the unit and she is distressed. She doesn't want to be here, and you have suspicion that she's still suicidal and still at risk of self-harm. All of your attempts to encourage Janet to stay have been unsuccessful, so you feel it is best that we use Section 5.2 of the Mental Health Act so that we can keep Janet here to maintain her safety and get her formally assessed under the Mental Health Act. Section 5.2 of the Mental Health Act is a temporary hold implemented by a doctor on the ward. It doesn't have to be a psychiatrist, this can be any doctor. This is to keep the patient in hospital against their will to allow for a formal Mental Health Act assessment to take place. So Janet's wanting to leave and we've got concerns for her safety and her well-being. All attempts to encourage her to stay are unsuccessful. So now please refer to your handouts for this. You've got handouts 1 and handout 2. This will give you an example of the form. So the first part, handout 1, is to be completed by the doctor, and they've got their own separate training on this. For you nurses, you need to complete part 2. So I think that is handout 2. Janet will remain in hospital once this has been completed for up to what is now, in the coronavirus pandemic, 120 hours. This was usually 72, but this has been extended to 120 for the time being at least. So, and this is to wait for a formal Mental Health Act assessment. So this form, as you see, is called a Form H1, relates to temporary holding. If you don't complete part 2, then this section hasn't even started. So technically, Janet could leave the hospital and it would look like bad practice on our behalf. Try not to be put off by the wording of the form. As guidance, where it says to be completed on behalf of the hospital managers, you as a registered nurse are in that moment acting on behalf of the hospital managers. And in most cases, this form should be delivered to you in person by the doctor, and the time that you put on it is the time that you received it. You then need to give Janet a leaflet explaining that she has been detained under a 5.2 and explain to her what this means and how long it will last. She can't appeal a 5.2 because it's too short. Here is an example of a patient information leaflet. This one relates to the detention of patients already in hospital, i.e. a Section 5.2. There are different leaflets available for different sections, and if you look at the top right, this one's for a 5.2, but there are other leaflets in the folder relating to, for example, a Section 2 or a Section 3. So after the section 5.2 has been started and Janet's been informed that this is happening and what this means for her, you would then need to contact the approved mental health practitioner team. This is not the mental health liaison team, they are a separate team of what we call AMPs, usually specially trained social workers in most cases, and they are a team of people that will work as part of County Council, and they'll cover the whole of Derby City and Derby County, going out to do various mental health act assessments. So they need to be informed that the patient is now under a section 5.2. So going back to Janet, the 5.2 is in place and the team arrived to do a mental health act assessment. This usually consists of 2 psychiatrists and an AMP, as I mentioned before. So the assessment takes place, and this can take a little while sometimes, but after that it is felt that Janet is a high risk of further suicide attempt and it's not safe for her to return home, and she does require admission to a psychiatric hospital. However, Janet is refusing to go in voluntarily. Therefore, the decision has been made, after considering all of the least restrictive options, that it is in her best interest for her to be detained under a Section 2. Just for your information, Section 2 lasts for up to 28 days, whereas a Section 3 lasts for up to 6 months. It can be hard in the current situation to find a psychiatric bed in a suitable amount of time, and this can mean that sometimes the patient has to remain on the ward and possibly be sectioned to the ward until a bed is available. So now please make reference to handout 3. This is called Form H3, also Record of Detention in Hospital. So you need to complete this form when a new section is started here on the ward, except for a 5.2 because that's only a temporary hold. But in Janet's case, she's been detained under a Section 2 and it's going to start here on the ward. So the H3 is basically a form that confirms that a registered nurse has received all the documents that the AMP will provide you after their assessment, and you complete this form, and from the date and time that you complete, this is the date and the time the section will start. Now it's really important that you complete the address fully here. I know this sounds silly, but it's really important that you put the correct postcode, because paperwork that's incomplete and incorrect does in some cases mean that the whole section has been invalid. So fortunately, a bed has become available for Janet and she's ready to be transferred to the mental health hospital for treatment of her mental health. So handout 4 shows you an example of a Form H4, which is basically the form that authorises Janet to be transferred. This is also known as a Section 19. Try not to get confused about that. This really, Section 19 of the Mental Health Act states that basically a form needs to be completed for a patient to be transferred. So we are transferring Janet to the mental health ward, and this form needs to be completed, and you complete the first part and the nurse at the psychiatric unit completes the second part. All of the original, usually pink, Mental Health Act paperwork goes with the patient or with the escort, and this goes to the receiving hospital, but please take a copy for our records. So you may hear of patients who are under a section, such as a 2 or a 3, who will have something called Section 17 leave. So this means that a patient has a legal right to have escorted or unescorted leave from the hospital, authorised by their consultant psychiatrist. And this might be to go to the shops, for a walk, to see family, or for medical treatment. So this leave is escorted or unescorted. As I've said, it's for visits off the hospital. It can sometimes have certain requirements or restrictions, like, for somebody who maybe has a problem with drug and alcohol abuse, they have to be breathalyzed on return, or they have to be searched for drugs. So in this case, they may come over to us for medical treatment. Nobody is sectioned on a section 17 or under a section 17. The correct way to look at it would be to say that they are either under a section 2 or a 3, and they've been given section 17 leave by their consultant psychiatrist. You may also hear of section 136, more commonly seen in ED, but sometimes they have come to MAU. Section 136 of the Mental Health Act allows police officers to bring a person that they deem to be mentally disordered in a public place to a place of safety, which might be a Section 136 suite at a mental health hospital if there's a bed available there, or it might be an emergency department. This section currently, again in the pandemic, is lasting for 36 hours and can be extended for a further 12 hours. Usually it's 24 hours. The police usually will stay with the patient, but this can depend on how the patient's presenting. For example, if the patient is calm, they aren't resisting, perhaps they've even gone to sleep, the police aren't likely to stay. So we'll now talk about some frequently asked questions. Can a patient who is under a Section 5.2, a 2 or a 3 go out for a cigarette? So many nurses are concerned that they will be held personally or professionally responsible if a patient under a section absconds or then maybe even comes to harm whilst they're off the unit. This is a really grey area and is patient specific. It's important to remember that we are not a locked psychiatric ward and there is only so much that we can do. It is wise to consider the pros and cons of facilitating a patient leave to go outside for a cigarette. You might face challenges by implementing boundaries, and the patient may become very agitated, which may put you, other staff and other patients at risk in some cases. Or the patient might just decide, because they're feeling trapped, they might just decide to go themselves. And the patient might become quite resistant. Therefore, it may be easier to allow them to go out for a cigarette escorted. So if a staff member can go out with them, then this could be a good idea. You must be clear with the patient that they are under a section and that they understand what this means. If you really cannot allow the patient to go outside, I really suggest trying to avoid just saying no, because this can cause a negative reaction by just hearing, no, you can't, you're under a section. The patient could get quite resistant, especially if they genuinely really just want a cigarette and then they're going to come back. So it's best to try and give options and explanations. You can also be clear with the patient that they must return to the unit and what will happen if they don't. It's okay to hand responsibility back to the patient if you think that they have capacity in this situation, and be clear about what will happen if they don't return. What if a patient who is under a section runs off the unit? Do we need to restrain them? This is another question that I frequently get asked. As a priority, do not compromise your own safety or the safety of the other patients on the ward to try to rescue the situation. We are not covered, nor are we properly trained for restraint techniques here. This might lead to the patient being injured, or in some cases, patients have died in restraint, particularly where the restraint's being faced down. This might lead to a patient or the patient's family suing the trust. We can use force that is necessary and proportionate to prevent harm, but in some cases it may be safer to let the patient go and then follow missing persons protocols and security and notifying police if they go off the grounds. Again, remember, we are not a locked psychiatric ward, so there is only so much that we can do. Does a patient under a section need to be on an increased supervision bundle? Not necessarily. Risk assess the situation. You can call the ward they've come from and ask them for background on whether the patient has a history of absconding or self-harming on the ward and what their thoughts are. You can ask them what level of observations they had the patient on there. Think about if the high levels of observations are going to agitate the patient more. And of course, ask the patient themselves, ask them how they feel, ask them if they feel safe, and ask them that we suggest that it's easier for them to work with us to maintain their safety. Again, we may be able to hand responsibility back to them if we think they've got capacity to make choices. We should not assume that just because someone is under a section and they have a mental illness that they are automatically going to be a risk of self-harm, a risk of running off, or a risk of violence. Do I need to see all the section paperwork when a patient comes here for medical treatment under a section? No, you do not need to see the paperwork. If the hospital states they are under a section, then a verbal handover of this is fine. You don't need to see all the original paperwork. It's not going to be useful and it's not necessary. You may call the ward and ask for a copy of their Section 17 leave. It's not essential, it might be helpful for you, but ultimately this doesn't make any change to your treatment plan. To finish off, we make decisions on the ward here as a team. Most importantly, document, document, document. You must document your decisions and risk assessments on how you came to any decisions, such as allowing a patient to go outside for a cigarette or why you did not restrain the patient that was running out the door. If it isn't documented, it didn't happen. Thank you for watching. If you've got any questions, please speak to me or email me and I'll get back to you. I know that this isn't the easiest of topics, and I think as you go through your job and as you get to know the Mental Health Act, you'll learn about it through using it.